So today we're looking at the lower back, a bit of mobility and accessory work to try and keep it nice and healthy, relieve pain. What we're going to focus on is a couple of exercises to try and stretch out the QL and your back itself, hips, shoulders, thoracic, and then a little bit of accessory work or strength work just to keep the hips nice and healthy. Generally for the lower back it's secondary, so unless you've had trauma directly to it, it's often that it's something caused over through habit, so either like hip dysfunction or lack of mobility strength, which is then causing like slow chronic changes to the back and stress, or pain and dysfunction somewhere else in the back or body, a movement habit, which is again causing a twist in a load that it can't quite cope with. So it's going to look at releasing a little bit of tension and then getting these accessory exercises nailed down. First one, it's going to be a variation of one we've done in the past. We're going to use our elbows instead of the stick that we've used in the past for the side lean. So from there, what we're going to do is just drop one elbow to the floor and then just lean out, twist and reach as far as we can. So again, you can progress it as far as you want. You can change how far you reach and lean. You can change how far you come up. Try to keep that hip down. It's entirely up to you. But what we're working on is trying to keep ourselves nice and stacked. So just dropping straight down to the side, getting our body relatively straight and driving our hip up as high as we can towards the ceiling and folding down. Depending how tight you are, depends how much you want to feel it. Alright, you might feel nothing, you might be mega tight on one side. It's just a little one to start getting you opened up and see how things are feeling. So again, I'm pushing through these ribs as far as I can, twisting this bottom shoulder through, and then reaching away as far as I can. Alright? Should feel quite nice. From there, next one is a favourite of mine. It's one we've done in the past, but it works for a lot of different things. So you lie on the floor, one leg lifted up, arms overhead. I might run out of space here. And from there, all we're going to do is plant one arm in the floor as we lift up and rotate away from that bent knee. Alright? We'll get as far over as we can. Almost made it. So, I'll rotate over as far as I can. Just focus on my breathing. Try and relax. So, depending on where you feel this, might be a clue to where your lower back pain's been triggered. If your glutes lock solid, or your knees lifting right up straight away, chances are you've got some hip mobility issues, strength issues. For whatever reason, that arse cheek's way too tight. If, like me, you get stuck either in the shoulder, so the bottom of the shoulder blade, or your side, the bottom of your obliques, bottom of your ribs, that can also cause some issues with your lower back and your movement. So what we're going to try and do is just hold it and focus on our breathing. Nice deep exhales. Try to imagine this right shoulder after taking over dropping down to the floor. As we're going, what you can focus on is trying to lift this knee up and then down. If you've got a partner, you can get them to guide it for you, just gently, and it should give you a nice big stretch right through the glute. Once you're done, you can just roll onto your back, nice and slowly, like a stick. Grab a hold of your knees and just have a little rock to release the tension. Alright? If you're unsure how long we do it for, you can set yourself a time limit, so 30 seconds, 45 seconds, 1 minute, etc. The max I would do is 2 minutes. Or you can just do it through breath work and breathing. Concentrate on about 5 or 6 deep exhales and seeing how much change you can get per side. So, next we've got the hip cars. So, working on the hip mobility and a little bit of hip strength. So you're going to pop your hands on the floor, just rest your head in your hands. If you've got a pillow and want to use that, that's fine. From there, the first one we're going to try straight leg. So we're just going to lift as high as we can. Again, if you get pain on one side doing this more than the other, or like I can get quite a bit more height on one leg than the other, that might be an indicator of where your lower back pain is as well. So if it's lifting that leg backwards into flexion, so anything that goes back that way and drives the spine forward, that bend, that can be a trigger. So similar sort of movement to the top of a deadlift, or extending through a snatch, anything like that, we know that repeated motion could be triggering your pain. So just to be aware of what you might need to start avoiding and working around to rebuild that strength. So from there, lift the leg high as you can, then we're going to lift it round to the side, rotate as far as you can, and then pop it down. And again, lift it up, back round, and down. Right, so you can go for reps. 4 to 6 should be enough. Should start getting quite tough if you're working to your max height and range. The second one, you're going to tuck your foot, drive it up towards the ceiling, and then rotate, lift round and down. Oh, this one's hard. And lift up, rotate, pull back round. Alright? And then down. Each time, as you lift, you're going to rotate, then move it round and down. Oh, that last one I really struggled with. You can adapt it to your range quite easily. So if you can't move very far, you don't need to push too far. You just try and work on that range over time. If you can, try and work on building the height and the amount of range you can lift your foot through. And either way, you're going to find the limit with where you can start improving and building a bit more strength and activation throughout the hip. Alright? Have a go. Quite simple, but they do work and it will help. And something you can add in and check over from the compared to the previous weeks, just a little bit different. Okay? So yeah, have a go guys. Take care, enjoy. If you get stuck, just let me know. Alright?